Hi, good morning. This is Dr. Mark Sehl, and this is the sixth talk in a series of talks on what makes for a good psychotherapy session. Today we're going to talk about listening and silence. The intervention is silence. Hopefully the therapist will be listening. Sometimes therapists don't. I want to thank Dr. Jerry Lucas and Dr. Marie Lucas for helping me become a better therapist. Silence is very important. The reason being is that we want to give that person a space to exist with us in the room, so we can be as attentive as possible, and we may be the first person who's really paying attention to them, listening to the story of their life, because often people are listened to and they're responded to with, as we've learned about in many of the talks, they're responded to with judgment, which is a killer. It's a soul killer. So we want to be very different than other people who have been critical or humiliated this person when they've tried to tell someone else about the story of their life. The old dictum is start where the person is. Often that's not followed. For instance, somebody came to me for a consultation recently and said to the therapist right off the bat, asked her about her family, and what was your family like? And she said, I didn't want to talk about my family. And she discontinued treatment. I asked her, by the way, if that happens with me, if I say something that puts you off, would you be able to tell me? Which is very important to start to have that kind of a expectation that will happen in therapy, because when you do something as a mistake, then if you don't have that kind of built in to the treatment, the person will just act out and leave. So this therapist had an agenda, definitely. Most people, by the way, when they talk about, they don't want to talk about their childhood, unless if they open the door, then the door is open, you can ask them about their childhood. But if they don't open the door, it's best to not walk through it. They're not ready. And many people have very, very difficult family situations. I think most people that I've worked with have some childhood trauma, very emotionally disturbing experiences with their caregivers. So you don't walk there until you're invited to. I said that before, but it's very important. As a matter of fact, that goes true with most questions. You wait until the patient gives you an indication that they're ready to talk to about something rather than intrude on them. Another patient that I saw fairly recently said that her therapist would talk to her about similar experiences that her other patients had with my patient. And my patient tearfully told me that she said, I didn't want her to talk about other people, I wanted her to listen to me. Going back to the past again, I did mention this in another talk, but one time a patient walked in to see me, and she said, I've never been to therapy because I thought you had to talk about the past. And I said, no, you don't have to talk about the past, just come and talk. You're doing a lot by coming here and talking about whatever you want to talk about. So she stayed with me for quite some time. About 2 years later, she was able to cry about her past, but in her own time. I usually like to ask people when they come in to see me, the first thing that I would say was, what brings you in to talk to me today? That generally is enough to get people started. You don't have to ask specific questions. Therapists have their agendas with patients, and parents have their agendas with children. So often when parents ask their children what they would like to be in life, for instance, if they're really interested, they'll listen. If they're not interested, the child will say something like, well, I'd like to be a painter or a rock star. And the parents will be very disappointed, or they might not show it directly, but indirectly the child can pick this up. And if this is repeated over and over again, the child gets the message that the parent is really not interested in their child being genuine. And that's a sad state of affairs, because if that continues, you'll have a false self which then has to be recouped and the real self found later on in treatment. I remember a patient was telling me about a story about his mother, and every time he would bring something to her attention about what he did in the day, or if he went to he saw a movie, and he would tell his mother, and his mother would use that as an invitation to talk about what movie she liked. And he said something very telling about narcissism. He said, "My mother never came into my world, so she really didn't sense him." And one goes on through life, with this kind of experience, where you're really not known. Very important. Intimacy is really being known and recognized. And back to that quote, it's joy to be hidden and disaster not to be found. So everyone needs to be found, but in their own time, they need to find themselves, basically, with the help of a therapist. Another person was programmed from childhood to be a banker. How do you program a child to be a banker? Well, you say, that's the best profession you can have. It's financially secure. My father was a banker. Your grandfather was a banker. Same thing, my father, your grandfather, right? But everyone's a banker, so be a banker. Well, this person as an adult was a banker, and but his regret was that he also liked art. He never could follow art because of the pressure from his parents. So he was beating himself up for not being able to make a decision. I said, it's very hard to decide what you want to do in life if all your life you're told what to do. So eventually he worked out some anger with me that gave him the safeness within himself to be angry with me, and then he could be regretful and angry and sorrowful and angry towards his parents for their controlling behavior. And he was able to go back and rediscover his passion and integrate that along with his being a banker. Patient comes in late for a session and apologizes to me for being late, and I said, why are you apologizing? It's your time. And I said, were you ever scolded in life? And he said, yes, I was called a brat. And I said, what were you called a brat for? And he said, I ran around a lot in school and at home. And I said, that's being a kid. That's what kids do. And eventually he was given Ritalin to calm him down. And he said, secretly, I didn't want to do that, but secretly, it had to be secret because he couldn't really raise his voice in objection to what his parents were doing. Ken Robinson tells a story about Gillian. Gillian is about 8 years old. I'm not sure the exact age, around that age, and she was sent to a specialist because of her disruptive behavior in school. She was handing in her assignments late, couldn't concentrate. So the specialist interviews the mother and child. The mother talks about her frustrations. The specialist says to Gillian, I'm going to walk outside. I'm going to be outside with your mother for a few minutes. So on the way out of the door, he turns the radio on, and as they are observing Gillian, he wants the mother to watch, and lo and behold, Gillian gets up out of her chair and starts to dance. So he turns to the mother and says to the mother, he says, your daughter is not sick, she's a dancer. Mother takes her daughter to dance school, and the daughter discovers that she's with people that are just like her, whether they're ballet or dancing tap or whatever. She said they needed to move in order to think. 20 years old, she danced in front of the royal family. She developed her own dance school, and later went on to choreograph Cats and Phantom of the Opera, which, as you know, are very, very well-known productions. And her last name is Gillian Lynn, and she's now a multimillionaire. What would happen to her if she was brought today, to a specialist? That was back in the 30s, I guess. And very easily it could be given Ritalin or Adderall to calm her down. What would happen to the dance? Probably good chance she wouldn't have become a dancer. So people are really not seen. It's another example of my patient was scolded and criticized. The problem was the parents, critical parents, not his, running around. And people are not seen, they're not heard, they're not listened to, they're not really paid attention to enough, so that we make the bad decisions. The Ritalin is okay with some children. It helps them a lot, but it shouldn't be. I think it's overprescribed, and as we've seen in the papers recently, it doesn't have very much of a long-lasting effect. There's a paper in the New England Journal of Medicine. I noticed just recently, thinking about this subject of movement and the brain, and this paper studied 400 and some subjects, 75 years of age or older, and they found that the only physical activity to offer protection against dementia was frequent dancing. Reading, 35%, reduced risk of dementia. Bicycling and swimming, 0%, which was interesting to me. Doing crossword puzzles at least 4 days a week, 47%. Playing golf, 0%. So dancing frequently, 76%. That was the greatest risk reduction of any activity studied, cognitive or physical. In terms of silence, patients and therapists can be uncomfortable with silence. Therapists can have a countertransference reaction to a silent patient. They may feel that they're not doing anything. Their feelings of self-efficacy can be challenged. So in that case, that's why it's important for therapists to be aware of their reactions, as conscious as they can be, and then if they can't resolve it on their own, they take it to their own analyst or therapist. But it's very important because they need to be able to be silent with their patients. They also need to be able to have the capacity to talk with their patients. This is not just, it's not just being silent, although that's the best intervention, but sometimes you have to have the freedom and to be able to do both when a patient needs it. And that's very important to know. And that flexibility of a therapist comes with a lot of training, because often therapists are afraid to take a step to the right or to the left because they're afraid they're going to make a mistake and it's going to ruin everything, which generally doesn't happen. If you can watch and observe your patient's reactions to any intervention that you make and be able to address it, they're not going to be big errors, but if you can't address it, then there will be big errors. You won't be able to pay attention to your patient's reaction to your intervention, and won't be able to correct yourself. Remember in talk 4, Sehl, the 9-month-old infant, talk about not being seen. Well, his mother had mother transference to her 9-month-old infant Sehl, and when she discovered that with the help of the therapist, she was able to see how she was reacting to Sehl just like her experience with her mother. Her mother, she was very rejected by Sehl. She would try to engage with him, smile at me and play with me, things like that. But she was coming in too much, too quick, and Sehl needed to back away, as infants do, in order to recoup. And she didn't understand that. And once her therapist pointed out the similarity she had in her behavior with Sehl and her similarity with her behavior with her mother, they were identical. So once she could discover that, she could perceive her son as who he was and be able to love him. It's a very moving story. So we want to learn what we've done, what's happened to us in our past, so that we don't have to repeat the same story with our children. And that's why it's very helpful for when couples are in therapy with me, that they can have the experience of remembering their past so it doesn't interfere with children if and when they want to have them. If a patient is uncomfortable, one might ask, is there anything specific that they feel uncomfortable about the silence? You could ask them also, is there anything that you could do in order to help? Asking non-threatening questions is also helpful with patients who are having difficulty talking in a session, like how was it to get to the session today, or perhaps was there something you ate today? How what was your breakfast like? Things like that that are non-threatening can stimulate someone who feels very uncomfortable or is not very talkative. And last but not least, it's good not to pressure a patient to talk, because as we've discussed in the other sessions, patients can be their angry feelings can be aroused by too much pressure to talk. That's why it's a good sometimes to say, well, no, it's not necessary to talk here. You don't have to talk if you don't want to. So that reduces the pressure rather than challenging the resistance, as sometimes analysts used to do or therapists used to do, is to be confrontive. And it was a terrible thing to do. And the patients wouldn't come back. They were so threatened by their own inner reactions to that kind of questioning. So I want to thank you. Again, this is Mark Sehl. I'm going to sign off and look forward to another video. I'm going to talk about another intervention and technique called following the contact function. On the page, you'll see a button that says subscribe. I wish you could push that if you can. It's very easy to open up a YouTube channel. So you fill out a few questions. I think you have to have a Gmail address. And then you'll get my videos uploaded to you automatically. And there's also a like button and a dislike button. Thumbs up, thumbs down. So make your choice about that. That would help me see how my videos are doing, and I can adjust my videos according to how people are receiving them. And so subscribe and comment. There's a comment section. So make whatever comment you'd like. And I listen to them, I read them, and I also respond to them. So again, thank you very much. This is Mark Sehl. I appreciate you being here and listening, and I'll see you soon. Bye. Bye.